Hello again. Today I was thinking of talking about diabetes and prediabetes, somewhat commonly known but uncommonly understood problem. I'm always curious when we start putting labels on prediabetes, pre-hypertensive, pre this and pre that. What is the advantage of doing this? Do actually pre ever becomes diabetic? We have seen precancerous skin lesions, precancerous colon polyps, and they do become cancerous. Uh, question is, what is the percentage? Should we be pushing for treatment in everybody? The blood pressure monitoring is the same story. We used to accept 140 systolic as normal, but then we changed it to 135, and the diastolic also went down. Question is, are we preventing target organ damages that is done by this elevated blood pressure? Many times we treat cancers, breast cancer after lumpectomy, and say that it will prevent the recurrence. Radiation, chemo have been added. Do we have a statistical data to say how much does it prevent? If someone doesn't do it, what's the chance of recurrence? But again, I'm not talking about cancer today. I'm talking about blood sugar, prediabetes, which many of us are afflicted. As you probably know, the incidence of diabetes has gone up. The prevalence was something like 8.5% or so, maybe about 6-7 years ago in this country, US, which has now gone to about 11+%. And literally 98% of these are type 2 diabetes. The criteria on which this pre-diabetes is mentioned, or for that matter, to some extent, diabetes, are a little bit different for ADA, American Diabetic Association, and WHO. So these criteria, when they differ, what is the prevalence of diabetes on a follow-up when we follow these people? That's the question that I'm trying to answer. So the ADA defines pre-diabetes a little differently than WHO. So if somebody's blood sugar is 100 plus, ADA would call it pre-diabetes, as long as it is less than 125. When you look at the WHO's criteria, the blood sugar greater than 110, but less than 125 would be called as pre-diabetes. If you're talking about measurements of hemoglobin A1C, we're looking at 5.7 or less would be normal, 5.7 to 6.4 would be considered pre-diabetes. By ADA criteria, the WHO allows a little bit higher, so they talk about 5.6 to 6.9. So in WHO criteria, 6.9 is considered hemoglobin A1C as still pre-diabetic. And of course, if someone does the old style 2-hour postprandial after taking 75 grams of glucose, 2 hours down the road, whether the sugar stays high enough, ADA defines, American Diabetic Association defines pre-diabetes as sugar after 2 hours of glucose load to be between 140 to 199, and the ADA, rather the WHO, does about the same, greater than 140 but less than 200. So I came across a study on this diagnostic of pre-diabetes versus diabetes, and also the comparing the ADA criteria with WHO criteria. So the question is, what is the incidence of people developing diabetes when they have a diagnosis of pre-diabetes based on ADA criteria versus WHO criteria? Apparently the study was done with literally 8,844 people, of which at the time of entry into the study, approximately 1,016 were defined as pre-diabetic with an ADA criteria. So they had a little bit higher blood sugar, greater than 100, or hemoglobin A1C was greater than 5.7, or less than 4. Not everybody had 2-hour postprandial. So when they analyzed these people with WHO criteria, based on WHO criteria, the same group had about 1,382 people diagnosed with prediabetes. So the incidence was 40%. Incidence was 40% when they used the lower criteria, which is American Diabetic Association. So 40% of the people were told you have prediabetes. When they used WHO criteria, only 16%, 1/6, were told that you have prediabetes. They were followed for several years, and this is where the things get a little dicey or important. So when they followed these 45-year plus patients for 10 years when they were diagnosed with prediabetes, and how many of these people became diabetic at the end of 10 years, the incidence with men and women was different. When you use the American Diabetic Association criteria, the incidence was about 14% with the women, while it was in men it was 9.2%. So for whatever reason, women became diabetic in 10 years, a little bit more when you use American Diabetic Association criteria. Again, not 100%, 10 years, only 14 and 9, women and men. When they use WHO criteria, approximately 23% of women became diabetic and 24.6% men became diabetic. Now, remember, that means literally 75% of the people who were told you have prediabetes did not become diabetes, even when using a little bit more liberal WHO criteria. This is 10 years. Now, what's the chance that somebody who is told to have got a prediabetes and they're followed for lifelong, and I don't know whether it is 70 years or not, but something like that, then it becomes a little bit interesting, because with an ADA criteria, the criteria where it was strict, less than 100, approximately 57.5% women became diabetic lifelong. So still literally 43% women never became diabetic when ADA criteria were used. However, when you use WHO criteria, 80% of the women became diabetic lifelong. So only 20% did not develop diabetes. In men, this was 46% with American Diabetic Association criteria and 68% with WHO criteria. The essential conclusion of this study is when you use stricter criteria where your sugar is, say, 102 on a fasting, or your hemoglobin A1C is 5.7 or 5.8, the chance of developing diabetes is barely 10% for 10 years. When it is followed for lifelong, 57% become diabetic, still 43 do not. Now, if you use a liberal criteria that allow the sugars and hemoglobin A1C to be a little higher as a pre-diabetic criteria, then at the end of 10 years, 24% become diabetic, so 76% do not. And lifelong, only 20% with rather liberal criteria do not become diabetic. So my conclusion is that if you use WHO criteria, which is a blood sugar which is slightly higher than 100, they allow 110. So if your blood sugar is 112, 14, or up to 125, you have 80% chance of getting diabetes. Again, 80% chance of getting diabetes in a lifelong for sugars fasting greater than 110. But if you're looking at 10 years, you have only 25% or 24% chance of becoming diabetes. So you should be very careful if your sugar is ranging around 110 plus or hemoglobin A1C is close to 6. and you should do the life change, exercise, diet, and close watch of sugar intake, carbohydrate intake, and watching the lipids would help you. So again, either way, if your sugars are elevated, not 100% become diabetic, but if the sugars fastings are greater than 110, 8 in 10 will become diabetic lifelong. Hope this helps you to manage your own health. If you like it, please subscribe and follow. Have a nice day.